All right, thanks, Ed. And thanks everyone for joining. I'm Sumithai Vidal. I'm a senior product manager here at Nava, and I'm working on OSCER. And to restate our vision, OSCER is an open source sidecar application that works alongside existing Medicaid systems to help states meet HR1's Medicaid work requirement rules. Our goal is simple: help states comply faster and protect the coverage that millions of beneficiaries rely on. Quick recap of what we've shown across the last few demos. We built this deliberately in slices in a thin end-to-end steel thread approach. We use this approach so we can get it in front of users, states can plug it in, see determinations flow through, and we can iterate fast based on feedback from states, partners, and policy experts. If you've been to prior demos, you'll recognize the various pieces we've shown before. Today, you'll see how those pieces connect and what's new. We'll have a Q&A session at the end of this, and you can ask questions on anything we've demoed. So here's the full loop at a high level. If you've joined, you've seen this concept of operations or 10,000-foot view multiple times. Ed just shared it as well. But now I want to map our product to it more explicitly. We start with intake, either a batch upload or an API request with ex parte signals coming from the state. OSCER then auto decides wherever it can, marking people exempt or compliant. And then we notify members with clear next steps. Members get a guided, mobile-friendly experience to either report activities or they can check or apply for exemptions. And on the staff side, the system creates cases and tasks only when human review is actually needed, and that's all manageable in OSCER. Again, the through line is automate first, maximize the no action needed, and make everything else simple. So let's go through the concept of operation step by step to show what we've done. First, we accept client ex parte data through batch or API certification requests. On intake, states can start either way, batch upload or API. A lot of states prefer batch jobs because it's the quickest, lowest lift way to get operational, but the API is also available. If you're wanting to start with that, you can, and the certification request, whether that's through API or batch, is the front door to establish a connection. Our API docs are live, batch is available so teams can start implementing right away, and you can choose the path that best fits your technical setup. Next, OSCER checks for any automated compliance and exemptions. This is the biggest leverage point here, using data the state already has to reduce burden. So instead of going the path of someone needs to look at this, OSCER takes in signals like eligibility factors and work hours and runs them through a rules engine. OSCER can automatically mark someone compliant when they meet the 80-hour target or exempt if OSCER finds a qualifying exemption. We can then send a clear notification of status to the member and avoid creating a caseworker task entirely if it's not necessary. And if someone falls short of meeting their hours, we don't just label them non-compliant. We show how many hours we found, how many remain, and what to do next. So members get clarity before they're at risk, and staff only see cases that truly need attention. So we're able to notify members if it's relevant, if they need to come in and into the OSCER app to report activity or request an exemption. So here the member experience is designed around one core principle. Members only come in when they need to. Because we're using ex parte data, OSCER can automatically check exemptions and compliance first. If someone is already exempt or compliant, they get a notification of their status and never have to log into OSCER if they don't want to. If they do need to report, they get a clear path to either report activities or they can still claim an exemption. And it's all mobile friendly, plain language, and step by step. So we demoed our first iteration of the exemption screener, and this exemption finder feature is directly from community feedback. People often don't even realize exemptions exist. So we added an exemption screener up front to surface eligibility early. It's meant to reduce the false non-compliance caused by confusion. And you'll see how we've strengthened this screener in today's demo. We additionally expanded activity types to match the statute more clearly. So work, income, education, community service. So states can map policy to product and members can report, members can report on all the engagements that that allow them, that they're allowed to, and make sure that they meet the requirement. So we've also demoed our case management end-to-end experience, and staff can see tasks assigned to themselves, search for members, see the case queue and case details, go into the tasks, and under that case, they can assign tasks to themselves, work those tasks, and then they can review member documentation and take action on the community engagement requirement by approving, denying, or requesting more information from the member. The goal is to keep the workflow tight and consistent. Everything staff need to move a case forward is in one place with clear next steps, and a clear status. On the staff side, we implemented least privilege authorization, so staff only see what they should see. For example, admins can see organization settings and roles. They can upload batch files in the interface, while caseworkers can work their cases based on the county or region they're located. So based on feedback, access is scoped by program and by region, which means it can be a county administered or state administered model. So staff operate in their specific regions and programs. And this matches how agencies actually run operations and gives security teams the guardrails they expect. And that's the full journey. You've seen the steel thread of these step by step. Again, we built it one slice at a time so states can get it running and we can iterate based on needs and enhance our functionality. Finally, we've also shown that OSCER is open source and more people are actively using the repo. So we made it easier to adopt with clearer docs for running locally, a setup video that you can see here, how to get data in, working with batch files. We have our roadmap publicly available and a way to request features. The goal here is to make this practical, reusable foundation that states or vendors can stand up without guesswork. Again, you can ask more questions about anything we've demoed. So now let's get into what you'll see today. We'll showcase two main things, an updated exemption screener and our recent usability study findings. We worked on enhancing the exemption finder. This was important because when work requirements take effect, the biggest risk isn't that people are ineligible, it's that eligible people fall off because the process and the policy is confusing. What we have seen is that people don't know what exemptions are. We've heard consistently terms like exemption and good cause don't translate. And so we flipped the burden, and instead of asking members to understand policy categories, we ask simple questions and then tell them what they may qualify for and what they'd need to do next. This includes clear guidance on documentation, what to upload, examples, and when it's actually required. The goal is to surface exemptions early before someone gets stuck in the reporting and to reduce back and forth for both members and staff. And we built this to be fully configurable by each state. States can turn specific exemptions on or off, customize the wording, and help a text to match their policy language, set their own documentation requirements, and even reorder how exemptions appear in the flow. So we're showing this on the screen here. Our solution uses a template-based approach to manage complexity. So instead of writing custom code for every single exemption, we've built a screener engine that reads from a simple list. So this means adding or modifying exemptions is a low-code task focused on content, configuration, and policy rules, rather than technical infrastructure. And then we'll show our recent member usability study. Getting member feedback is a priority for us because of the historical failures these programs have seen with usability and comprehension. We ran moderated sessions with people who have Medicaid or similar benefits experience and tested two things: whether the homepage makes it clear what someone is being asked to do, And second, whether someone can successfully report work hours end to end. We're looking for where people get confused, what language trips them up, and where they might drop off. Then we'll turn those findings into product changes. We have this published in GitHub, and so I'll show that. We have what we tested, what we learned, and our next steps. So let's jump into the demo. Let me just refresh this to make sure I'm still logged in. And we'll start with the updated exemption finder. I can get started right away from the hero banner at the top. So I'll click Get Started. And we start with an initial page to orient the member. Tell us about your situation. We know that the term exemption might be difficult, but there's also a factor of we want to start to introduce these words so we can educate the member to learn what's happening. And if they need to like call in to talk to a staff member, they're more empowered to communicate their needs as well. So we created a screener that's multi-page, written in plain language, and the language is based on current research, and we'll continue to test and update the content through our learnings too. So we prioritize the questions in the screener based on the populations most likely to be subject to the requirement, which is Group 8 and the expansion population. Research from the Center on Budget and Policy Priorities, CBPP, shows that these are the biggest risk of losing coverage, and not because of ineligibility. It's eligible people losing coverage because the process is hard to navigate. And CBPP has been explicit that implementation details and administrative burden can drive coverage losses, even when people remain eligible. And we took that into account when putting this together. So here, the screener architecture is all the same. We have a plain language question, helper text. This is the helper text that explains what the exemption type is, and an option, yes or no, giving additional context. So as we go through this flow of questions, I'd love your reactions or feedback during our Q&A. We had a lot of discussion in our initial showcase of this screener, and this is exactly the kind of workflow where small wording and ordering choices could make a big difference in outcomes. So plain language approach here, which same problem KFF has highlighted. Many people who appear non-compliant may actually have legitimate barriers like caregiving responsibilities, and the complexity is what causes people to fall through the cracks. So I'll go to the next question. Are you currently a caregiver for a child 13 years of age or under? I'm going to click no here. Do you have a current medical condition that makes it hard for you to work or do daily activities? So this was an analysis. We have this question around the medical condition because there was an analysis by KFF that found 44% of Medicaid expansion adults have chronic physical or behavioral health conditions, and nearly a quarter have mental health conditions or substance use disorders. So I'm going to click no here. And then this one, we separate this out, the substance abuse disorder, just because to make it cognitively easier for the member. And here I'll pick yes, just for now. So you can see that a member is taken to the documentation support and the exemption type. Exemption type is here. Substance abuse falls under medically frail. And we have supporting documentation. So if someone answers yes, they see what kind of documentation that they need. So they don't have to guess, and staff don't have to keep looping back for missing pieces. Again, this is easy to update based on state needs. I'll actually go back to go through the rest of the screener. Are you currently, have you been released from jail or prison in the last 90 days? I'll click no. Are you currently enrolled in school or at least in school at least half-time? Again, we give some more details on what that means. Half-time is typically 6 credits for undergraduates. I'm going to click no. Have you recently stayed overnight at a medical facility, at a hospital or medical facility? And I'll click yes for this one. It's the final question. And you'll notice here that the exemption type is different from the previous one that I showed, and the supporting documentation guidance is different as well. So it's tailored to what they pick, making it easier for them. And then importantly, this is configurable by state. Policies and operational choices are still evolving, so states can turn exemptions on or off, and adjust the wording and the helper text, change the documentation rules, and reorder the questions. And it's all low code. That's it for the exemption screener. Let's go into our usability study that we did. And I'm actually going to go to, oops, the actual plan first. So we started this work because the evidence is really consistent, and the theme I keep repeating is the biggest risk isn't that people are ineligible, it's that eligible people lose coverage because the process is hard to navigate. And we've seen real-world examples of what happens when the reporting experience isn't clear. States that have implemented work requirements have seen thousands of people lose coverage, largely tied to reporting barriers and not eligibility, and the administrative overhead tends to be more substantial than the actual healthcare. So in our member usability testing, we wanted to make sure that if someone does need to report, the experience is genuinely clear and doable. So I'm showing our test plan here. This is available in GitHub along with the findings. And for this round, we ran moderated remote sessions with people who have, let me actually scroll to the participant screen, who have recent Medicaid or similar public benefits experience. We screened for adults 19 to 64. Just going to make this a little bit bigger. And we excluded people who work in healthcare, insurance, government benefits, or who have done similar research recently. So we're hearing from people who are closer to the real user experience. And in the session, we tested two main things. The homepage comprehension. So without clicking, do people understand what this site is for, what they need to do, and where they'd start? And can they complete a monthly report, upload documentation, and feel confident that they successfully submitted? You can also find the questions that we asked in the actual session here, and that's available in the doc. So let's share our findings. And under the same folder, you can see the findings. And I'll jump back and forth between the app and the GitHub doc so you can visually make the connection when I'm going through these findings. So there are a few initial findings. First off, language matters. The term community engagement doesn't reliably map to what people think they're supposed to do. Users initially interpret it as like a community or program engagement. Like, for example, someone said, well, I'd want to know how many people are signing up for this program. And they were even a little bit concerned about privacy. They were only able to understand it after reading more context. And so we did a simple change where it used to actually say Medicaid community engagement at the top here, and we changed that to the Medicaid reporting portal. All right, next finding was just that the homepage information architecture falls short of user expectations, meaning that the homepage was not as clear as it could be. And this was something that we had hypothesized was the case, and that's why we wanted to test it. Multiple users expected the language they expected the homepage to explain what the site or program is about before asking them to take action. And then they also said something along the lines of just making it more personal to them, welcome them, have some of their information. So a quick fix there is we did add like their first name and said like welcome to them. Next steps, we do have a few different designs to test the homepage experience and make it a more holistic experience. So thinking about a new member, what a new member might see versus what an existing member might see if they're returning. So next finding was that the exemption information was a little more buried than what users need. So just a note that we did test this with our previous version of the screener, but our findings were that users expected more details about exemptions right away. The majority of users wanted to know exemption criteria before starting any process. And so users didn't want to waste time going down the wrong path or feel uncertain about which option applies to them. So we are going to test some more homepage designs and change the language on the exemption finder call to action so members have a more clear path based on their needs. Finally, one final finding is that the 80-hour requirement and the reporting period lacks important context. So what that means is this 80 hours of community engagement, users were unclear if 80 hours meant monthly, per period, one time, or cumulative. There was just confusion about whether the requirement was ongoing or temporary. So this one is important for us to bring clarity around the actual reporting requirements if they do need to report. So we plan to test more around the reporting period language and what members need to include in the documentation for work reporting. And just to end on some successful patterns, so I'll go into this so you can see it. So the progress and the status indicators, this right up here, worked really well. The step indicators reduced anxiety about time commitment. Someone said, I love when there's bars where there's hope that it's going to end. And then the before you start page reduced uncertainty as well. Multiple users appreciated knowing the time estimate and the required documents up front. People also very much appreciated that their progress would be saved. They and overall, the flow completion, all participants successfully submitted reports within 5 minutes, and they gave feedback that the visual design was clean, uncluttered, and easy to scan. So that's it for the demo and usability studies. If you go under docs in GitHub, you can see there's a section for user research, and we have it we have the findings and the plan published there, and we'll continue to publish our future research there as well. We've so appreciated the research we've seen from others. Shout out to like CBPP, KFF, Sevilla, Code for America, and so many others. And we want to share our learnings back to the community too and learn from each other. So let's jump back to what else is coming up. So our roadmap is still focused and connected to our vision. Meet HR1 fast, ensure eligible people receive coverage, reduce staff burden, and keep states in control. I'm going to go through this a little quickly just because of time. This month you saw the exemption screener usability study, and we'll continue to share usability studies in future demo sessions as well. So continue to join us if you want to see that. In February, we're building out secure API authentication. This matters because it's foundational for states to integrate with OSCER at scale. We'll also build the Medicaid in-app integration, where we'll showcase how OSCER supports inflow integration, so redirecting members from the state Medicaid application into OSCER and then back if needed. And this matters because it keeps members in the experience at the moment they're engaged, reducing drop-off and collecting information in real time rather than hoping members return later. In March, we're introducing intelligent document processing. You heard Joseph talk about that, and we're looking for those similar outcomes they saw on SNAP. By catching those like quality issues at the point of upload, we reduce frustration for members, reduce staff workload, and free up staff to focus on getting benefits delivered faster. And we're implementing single sign-on for staff. This matters because staff already juggle multiple systems throughout their day, and SSO removes that friction and makes OSCER feel like a more natural part of their existing workflow. And in April, we'll do more on ex parte income. So OSCER will verify income using data sources states already have. People can be auto-cleared as eligible or compliant without needing to submit extra paperwork. That reduces the process failures and really gets like that increase in members who don't ever have to come into OSCER. And finally, SMS notifications. We've seen research that texting reaches people where they actually are, especially for deadlines and missing information requests. And we've seen this impact on SNAP and other benefits programs that we've worked on. So you can find full descriptions of these in the GitHub public roadmap and keep following along. And you can make feature requests in GitHub if you don't see something. And we do listen to your feedback, so we appreciate getting it. All right, we're going to open the floor for questions in a bit, but before we do, I want to say plainly, we are ready to support you in whichever path you're taking. We know that states are on a time crunch, and like Ed mentioned, if you're with a state, we can help you get the OSCER MVP in place in about 6 to 8 weeks, integrating with your system and ready to go so your team can build from there. And if you need a deeper integration support, we can partner with you on that. And we want you to succeed, and we'd love to help you however we can. That's kind of the big thing there. If you are a vendor supporting a state and interested in using OSCER for your implementation, we're also ready to support you. And we'll be reaching out to all of you in the next few days, and we'd love to talk more and explore if there's a path we can pursue together. And you can always reach out to us at medicaid@navapbc.com as well. I'll pass to Tiffany to get started with the Q&A. You can post questions in the chat. As always, we appreciate you all taking the time to join us. It's exciting to have the community come together to solve a common problem, and we hope you'll find ways to get involved, whether that's through OSCER or using our learnings in your own implementation. And our next demo day is February 18th at same time, 11 a.m. Pacific, 2 p.m. Eastern. All right, Tiffany, done.
Thanks. Thanks, Sumi.